Hello everyone, I'm Irma Baker. Welcome to our show. It's always so great to be here and to be able to talk with you and introduce you to guests. Well, for many of you who've watched the show over the years, you know our guest today. This is the time we do our Social Security update, and we have the man who has all the answers. Hello, Robert Fenn.
Hello there, Irma. How are you?
I'm doing fine, and it's always a pleasure to have you on the show to bring us up to date, because we know there are always changes with Social Security.
At least it seems so each year, but it's always my pleasure to sit down with you and for our viewers as well. So it's a great opportunity.
So what's happening? What is new with Social Security?
Yeah, well, I guess to start us off, being at the beginning of the year, the news was about the 8.7% increase to the cost of living adjustment is what they call it, COLA. And that means that it has a huge impact on not only the dollar amount an individual can receive each month, but there are other things as far as their work requirements that they can make. So 8.7% was the increase that was added to those who their payments in the month of January. Those who may have received an SSI payment, they received their check around December 30th. But for many individuals, their Social Security checks would be increased by 8.7%. Now, what I want to add for some of the listeners here and our viewers is that many times I found that people will take out their calculators and they will add 8.7% to the dollar amount that they get in the bank account. I get it, it makes sense, right? But however, I want to make sure that everyone is mindful of this, is that if you took a Social Security retirement check before that person reached their full retirement age, that means there was a reduction in that payment that they received. Now, what happens on our side of the table, we add that 8.7% to their amount as if they waited to their full retirement age, and then we do the reduction, and that's how we send out the Social Security payment. So they could be off on their calculator $1 or $2 because they're adding the 8.7% to their net amount, not to what I'll call their gross amount. So just be mindful of that.
Oh, well, it sounds like they're getting a better deal your way than their way.
Yeah, they are. By us adding to that gross amount, it would definitely benefit them versus just adding it to that net. By far, you're correct.
So that would be something that would confuse people, but what else is happening?
Yes, so with that 8.7%, it also has other effects, and anyone who's viewing us, they can go to our website, socialsecurity.gov, they can scroll down, and then we can see press release. They will see that on the right-hand side. Click that, and then they will see what is a fact sheet, a little PDF. They click on that, and they'll see all these numbers that I'm referring to. Some of the other things that were impacted by that, an individual could work and make up to $160,200. We're still taking the Social Security tax out. That's for the bigger wigs out there, so you can have that. Or if the individual is working, the dollar amount has increased on how much, if they're underneath the full retirement age, they can make. That dollar amount, I'm just rounding up, they'll see those numbers, $21,000. If an individual is turning their full retirement age, they can make now almost $56,000. So those things have also been impacted, allowing individuals to work a little bit more and still receive their Social Security payment. So those are the main things that individuals are going to see a change. There's some numbers that I also can share that is very important, is the dollar amount for SSI has increased from $841 to $914.
Okay, I'm going to back you up there a little bit.
Yeah.
There just may be somebody watching who doesn't know what SSI is.
That is true. That's true. And thank you for that. SSI stands for Supplemental Security Income. It is a needs-based program that individuals who are at least over the age of 65, or if they have a disability, if they're younger, or if they're blind, those individuals could be potentially eligible. Something that we found during the height of the pandemic was that our numbers for those SSI applications went down. In some areas, 20 or 30%. So we had to find ways, we at the agency, to say how do we reach those populations that may have that need. And again, for anyone who's watching, who's over the age 65, the SSI amount is $914. So what does this mean to our viewers? If someone is receiving less than $914 in their Social Security payment, and they're over at 65, SSI could be a supplement, no pun intended, for their payment. So let's say they were getting $800. $800 to $914 is still $114. SSI, in order to apply for that benefit, based upon their income and their resources, how much money is in the bank account, how many homes do they own, stocks, bonds, do they have other things like that. If they have limited resources and limited income, they may be able to receive that boost up to that $914. Now, if a person's Social Security check is over that dollar amount, then they're not eligible. Or maybe they had $5,000 in their savings account, then they may not be eligible for that. But it's still an application that I encourage individuals to be aware of it. Sometimes it's for children, sometimes it's for seniors. So those populations may have that opportunity to apply for that SSI. So thank you for asking that question.
Well, to somebody who is just wondering how they're going to get by and everything.
Yes.
I mean, Social Security is a lifesaver, but it's also very confusing, which is why we have you on all the time.
That's why I'm here. Yes.
That's right.
Yes.
So, has anything changed with the age eligibility?
Well, the full retirement age has increased. And let me make sure for our viewers so they understand, okay, what does it mean by increase, you know? And sometimes when I'm speaking and I'm doing my outreach, I'm thinking, because I know it, maybe they have heard it already. Not always so. So the full retirement age means when can I file to get the full amount possible? And so that full retirement age is based upon the year someone's born. An individual who's born between the years of 1943 to 1954, between those years, the full retirement age is 66. Prior years, everyone would remember 65. When I get to 65, that's when I'm going to retire, right? Well, that changed, effective in the year of 2000. So it is increased. And what's increased is in increments of 2 months. So anyone born in 1955, their full retirement age is 66 in 2 months. Those are born in 1956, 66 in 4 months. And you continue to add 2 months all the way up to 1960. So anyone born 1960 or later, their full retirement age is age 67. Now, it doesn't mean they have to wait till 67. They can file as early as age 62. That's standard for everyone. But their full retirement age to get the full benefit, those born after 1960, that is increased to age 67.
Well, some people might think that, oh, well, I'll take it early and take that cut, but boy, when I get to full retirement age, it'll go up. But that's
Right.
not the way, is it?
That is not the way. Now, you're correct. Many individuals think, well, I'll just take a little bit now, then I'll come back and talk to Social Security, and then I'll get a little bit more later. No, it's kind of like at home. My mom said, well, once you eat that, you need to finish what's on your plate first, right? And he said, okay, then you can come back up for seconds. Well, that's a little different. That's in Mom's house. For Social Security, once you start receiving your benefits, you are, I'm going to use the words, locked into that dollar amount. And that dollar amount that you're receiving only increases if there's a cost of living adjustment that we mentioned. Otherwise, when the individual started at age 62, then they turn to age 66 in so many months, or age 67, that Social Security check is not going to go up just because they reached that full retirement age. They have elected to receive a smaller amount in terms of monthly payment versus waiting to get a larger amount by waiting till their full retirement age. So you're absolutely correct. It will not increase once they reach that full retirement age if they took those Social Security benefits prior to that age.
So if someone is, say, late 50s, early 60s, and they're thinking, should I or shouldn't I, and all that, it sounds to me like they need to talk to somebody at Social Security and figure out just what impact it's going to have on them.
Yes, it's always important to be cognizant, proactive, and that proactive step that a person should take is by going to our website, socialsecurity.gov. Why did I point that out? Because years ago, we would mail out a Social Security statement, and it would come out 3 months before the individual's birthday. And I don't know if people were so excited they couldn't get any sleep. You know, my Social Security statement's coming. I don't know. Maybe that was just me. I don't know. But their Social Security statements would be mailed out. Those Social Security statements are no longer mailed out unless you're age 60. If you're age 60, then they're mailed out one time per year. So what do if you are 50 and age 60 and you're thinking, okay, before age 60, what do I do? How do I find out? Individuals can still go to our website, socialsecurity.gov. They register through the My Social Security portal, answer a series of questions. We have external partners. We call them LinkedIn and ID Me. An individual can click on those links, and it will allow them to answer a series of questions, and now they'll have access to seeing all of their work history. And then that allows them to plan. And they can actually now pick up to 9 different ages. They'll see in their Social Security statement, age 62, 63, 64, all the way up to age 67. They will see how much their earnings are going to be projected in the future. So that's a great opportunity. Check out our website, socialsecurity.gov, and then make sure you look at that option, the My Social Security account.
It's a lot, and it is so important for people to be able to understand what their financial condition is going to be.
Mm-hmm. Yes.
So what else is happening with Social Security?
Mm-hmm. Another thing that I like to encourage individuals to be aware of, whenever I speak about cost of living adjustment, and I say that Social Security is going to go up X amount of dollars by a certain percentage, the first thing I can see in people's eyes, there's a little twitch in there. They'll go, well, if my Social Security check is going up, that must mean Medicare is going up. And then how much are you going to get me for that? I'm like, well, it's not personal. But what happens is that Social Security gets word from Medicare. We're 2 separate agencies. However, Medicare handles their part, and then they will contact us. Last year, the cost of the Medicare Part B premium was $171.10. So individuals were thinking, well, if the Social Security cash is going to go up, are they going to add to that $171? Well, this is the first time in several years that Medicare Part B premium went down. And so now, this year in 2023, that dollar amount is $164.90 per month. So you could take home more, in terms of your pay. That was a big announcement, and that's how people took it and like, oh, this is great. $164.90 for my Medicare Part B, 8.7% is the increase. Now I want to make sure I don't gloss over or sugarcoat it too much. People have to be mindful that 8.7% was a high increase, one of the biggest in 4 decades, but that's a reflection of the economy. So if we have a higher Social Security check increase, that must mean there's higher inflation. So it's not exactly a great thing, but it's something that we like to make sure we inform individuals. Another party, meaning that Treasury tells Social Security, we then issue that payment. So that's something that also did change regards to Medicare, the Part B. And something else that changed effective 2023 that I think people should be aware of in regards to Medicare, there are different enrollment periods. There's something we call an IEP, initial enrollment period. That's 3 months before the month of 65 and 3 months after the person turns 65. The prior law in 2022 said that if someone was to enroll 1 month later than when they turned 65, the Medicare would start 2 months later. New law says that if they enroll 1 month after, it starts the next month. That's a great thing. More individuals then are going to be able to get their Medicare sooner. That's with the IEP. We also have something called the GEP, which means General Enrollment Period. Now here's the kicker on that one, Irma. If someone missed their IEP, and let's say that they missed something else that we call an SEP, Special Enrollment Period, means they retired and they have 8 months to contact Social Security to get the Medicare started, and let's say they didn't do that, then they have to wait to the GEP. And then there's a rule that says in the GEP, they can enroll January, February, or March. And then last year in 2022, that would make it effective in July. And then Medicare has a guideline that says, well, you should have taken this, and if it's been more than a year since you should have had coverage, they would assess a 10% penalty. Now, in 2023, the new law is if they don't enroll in the IEP, they don't enroll in the SEP, but they enroll in the GEP, they enroll in January, it'll start in February. Enroll in February, it'll start in March. Enroll in March, it'll start in April. So that means it's a lot sooner. So there's a lot of IEPs and GEPs and SEPs out there, but the point is that I want to make sure that everyone who's watching us, they understand that the change allows more individuals to be able to enroll sooner without having to possibly be subject to that penalty.
Wow. That really sounds like alphabet soup.
Yeah, because it literally is.
It literally is. But the fact is, as you just said, that that change is being made so that people can get their coverage sooner. And really, in the long run, more easily.
Correct.
Than before.
By all means.
But again, people like you who go out and do outreach and talk to groups and come on our show and do the kind of things to get the word out to the public are really more valuable than ever, because it does get more complicated, and you are one of the people on the front line who is absolutely there to make the communication available.
Thank you for that.
So, my gosh.
Yeah. And we definitely, that's what my role is. There are several individuals throughout the state who do what I do. They do a phenomenal job in Cuyahoga Falls and Dayton and Cincinnati and Toledo. And we get together and we try to, do our best in order to getting the message out for Social Security. And we understand that there can be some confusion. People watch TV and there are all these types of Medicare commercials, and they're like, okay, are they talking about me? Is there something that I'm missing out on? What am I supposed to do? Well, that's where Social Security is, and I encourage individuals, they can go to our website, socialsecurity.gov. There's a link that says ask for a speaker. I can come out and speak to a group. We can do it through webinar. That's one of the positive things that came out through the pandemic, is everyone now knows what the word Zoom is, and not just my pace, right? And now there's an option for that. So that is a great opportunity for us to be out there for the public, to make sure that they have accurate information. So yes, thank you.
Accurate is the key word there.
Correct.
Because we're talking about what people live on.
Yes.
Once they are dependent on Social Security, for many people, that is what they live on.
Yes, yes.
So have we covered all the changes or updates to that Social Security?
Well, I'm not sure if we have enough time to cover everything, but I would say something else that's important, just as important, that I can't ignore, is that there are scams that take place. And there are individuals who are looking to pose as if they work for the Social Security Administration or other government agencies. So I'm encouraging everyone who is watching us right now, is that if you get one of those phone calls, this is the Social Security Administration, something trying to scare you, that is not Social Security. Or if it's a actual live voice, that is not Social Security. Social Security will never threaten anyone. Some of these phone calls will say your Social Security number is going to be suspended. That's something we can't even do, is suspend a Social Security number. Just be mindful of that. We've had individuals contact us thinking that they received a phone call and they didn't disclose anything, and so they're just worried about that. So I encourage individuals to be mindful. That is not Social Security. We do mail letters out if we need to contact you. If an individual is to disclose something that they should not have disclosed, they can go to our website or to oig.ssa.gov, Office of Inspector General.ssa.gov. They can make their report. And quite frankly, people think if their Social Security number was compromised some way, people associate Social Security with Social Security number. Duh, makes sense. However, it's actually the FTC. So we're going to make sure we share that number with our viewing audience, that they should contact the FTC, and then they can make that report to say, this is how my Social Security number was compromised. And then so they, along with the oig.ssa.gov, they can put that information together, and hopefully we can track down some of these individuals who are, again, posing as if they are with the Social Security Administration when they are not.
Are they only making these scam phone calls, or are there other scams out there as well? Yes,
there are others. Sometimes it's in the form of a letter. Sometimes, it has not as much people going door to door. Sometimes it's an email. So they will send an email, and we encourage individuals to use your mouse and hover over that little link at the top in the browser, and then you'll be able to see it may be directed to another location. Social Security is not going to mail anyone an email. That is not how we contact. Generally, it's by letter. If we need to make a phone call, again, more than likely we're going to send out a letter saying we're going to contact you on such and such date to discuss whatever it may be. And the main point that I want to make sure that people get is that Social Security is not going to do any threatening, telling you to put your money on gift cards, using some type of Bitcoin, some electronic currency. That is not Social Security at all, or any other federal agency. That is not how we operate. So I just want to encourage everyone just to be mindful of that, be safe, and if you wish, you can just call and say, all right, you're from where? Social Security? Okay, what is your name? All right, can I call you back? And then you can call the Social Security number, 1-800-772-1213, and then that's the number that you can use to reach us. And if I can, I want to give somebody a quick little tip about reaching us. You can reach us, call the 800 number, easier, not easy, easier, later in the day, later in the week, later in the month, later in the day, after 10 a.m. Our hours are 8 to 5:30, but you can reach us easier after 10 a.m., later in the week, Wednesday, Thursday, Friday, later in the month, 16th or later. It's just a little, in my mind, it makes sense. Some of us wake up very early. We're so excited. We want to call Social Security. And then around 10 a.m., then the coffee sets in, right? So we have to take care of that need. And then it may ease the opportunity for people to call into our office to have questions. We have been open, if you will, to walk-in traffic since April 7th of last year. And so we've increased that, but I still encourage individuals to call our 800 number, the 772-1213 number, to see maybe we can handle whatever their request may be over the telephone, or make an appointment for you to come in. Individuals are wondering, well, during the pandemic, what was going on here? Our offices never were closed. Our offices just were open to our phone services and our online services, and then we had to limit how many individuals could come into our office. So now we're allowing more individuals into our office, but I'm still encouraging individuals to make an appointment, because we do have individuals with high health vulnerabilities that we need to make sure that they're still okay. The office itself at this time, you may still see the employees wearing masks, what have you, because we're still trying to protect those individuals that we're assisting.
Well, it's unfortunate that scammers are out there.
Yes.
But the fact is they are.
Mm-hmm.
And I just want to reinforce one point of what you were saying. If somebody gets a phone call, a message,
mm-hmm.
a phone message, a letter, or anything like that that has in it a number to call, what you're saying is, don't call that number.
Mm-hmm. Well, I would say sometimes I myself have mailed out letters. I have my phone number, have my extension on that. If the person wishes, they can just call the 1-800-772-1213 number and say, I've received a letter from a gentleman named Mr. Finn. Is there a Mr. Finn that works there? Yes. Well, Mr. Finn is trying to contact me. Can you verify that? That individual will be able to verify that I mailed a letter out to them to reach them that way. They can call that phone number. The key that I want people to recognize is that once that person picks up, there should not be any threatening calls, telling them their number's compromised in some type of crime, or that their grandson is going to jail, or that they want them to use their money. Then they're going to threaten you. Well, this is what has to be done. You need to do this now. That's when you know. And then that's the time where I would say hang up. That's the time I'll say shred that paper. But again, yes, we do mail letters out. That's our form of communication. Some people like to read and write, all right? So we still mail letters out. Sometimes we have to make a phone call, but we mail a letter first. So I just want to make sure they have that comfort knowing that, yes, Social Security still mails out letters, but we are never threatening anyone to send them, again, like I said, to jail or to put their money on gift cards. That's not Social Security at all.
So even the fact you don't ask for money.
Right. Yes. If a person is overpaid for a certain reason, we're going to mail them a notice. And even in that case here, that notice is going to say you can contact us. You can bring the letter into the office. Mm-hmm. They have 60 days to be able to address that. So you're going to see there is a communication and a process. Mm-hmm. It's not going to be where, hey, you only have such amount of time. Now we're coming after you. So you can feel that difference. that is not going to be something that's coming from Social Security. Social Security is going to give an individual an opportunity to address whatever the issue may be in the letter, and then by the phone call and or by them bringing that letter into our office.
And your offices are available.
Yes.
The phone number for Social Security
Yes.
is available. They don't have to trust what's on some letter that came out of nowhere.
Correct. Yeah.
Or a phone message or that. It really is scary.
Yeah, it can be. You know, but at the same time, I say to people, best way you can, take your time. Do you remember there was a time we were so hesitant to put our name and phone number in a phone book? Do you remember when people would call you and say, I don't want that listed, right? And, you know, we have changed a little bit. We're a little, you know, okay, we don't have to worry about phone books now. So now we have to be concerned with the internet and making sure that's legit. So this is part of life, is my point. And that for the most part, individuals are not going to be subject to these things, and they're not going to have that experience. So that's good. My job and my role is to make sure I don't want anyone to be subject to it. So I would rather speak about it, and so that way our listeners, our viewers are educated, so they can say maybe it won't happen to them, but what about their family members? So that way they can spread the word to say, okay, I heard this guy speaking to Miss Irma Baker, and he was talking about being aware of scams. What can we do to make sure we're okay? Let's call the 800 number just to make sure that's all right. Or we can bring that letter to Social Security office, and we should be okay. At the end of the day, just hang up or just shred it away. And if it is Social Security, if it is myself wanting to contact someone, I'll follow up with them, and they'll know, man, it's me, Mr. Finn, calling from Social Security.
Well, Robert, it's been so great to have you with us today. I always look forward to your visit to our show, and I always look forward to having all of you viewing us. So for RSVP, I'm Irma Baker. Have a wonderful day.
You are watching WCTV, Wadsworth Community Television.